続きまして、ヨルダン・ハシェミット王国王女で国際対がん連合会長のディナ・ミルアド様より Towards Comprehensive Cancer Care for All と題しましてビデオメッセージを頂戴しておりますので披露させていただきます。
Thank you, distinguished guests gathered here today on the occasion of this annual seminar focusing on what new drug innovation brings to our society, organized by the Japan Pharmaceutical Manufacturers Association. I am Princess Dina Mered of Jordan, and I'm also the president of the Union for International Cancer Control, the first from my region. I am grateful to Mr. George Nakayama, CEO of JPMA and chairman and CEO of Daiichi Sankyo, a UICC partner organization, for the opportunity to speak to you today. UICC is the oldest and the largest cancer-fighting organization in the world and brings together more than 1,100 organizations from 177 countries, whom we endeavor to support and acknowledge at every opportunity. Working hand in hand with international agencies like the World Health Organization, the International Atomic Energy Agency, and the International Agency for Research on Cancer, and alongside our national membership, we seek to raise awareness about cancer to the highest level of government so that cancer remains a key item on the global health and development agenda. Just as importantly, we aim to dramatically increase cancer awareness with the public, from global influencers to grassroots champions, through campaigns such as the World Cancer Day, led and organized by UICC. Every 4th of February worldwide, we provide a global platform to support the mobilization and engagement of governments, cities, schools, communities, businesses, patients, caregivers, and survivors. Before I was president of UICC, I was myself a caregiver. My child, thanks to the grace of God and quality treatment, is a cancer survivor. When my son was first diagnosed in 1997, I had to travel thousands of miles to the UK and later to USA for him to receive the care he needed. This is too far a distance and too high a cost for the majority of people around the globe. That is why I have committed myself to global cancer control, to do my part in ensuring that people, no matter who they are or where they're from, or how much their income level, should have the rightful chance to receive quality treatment and the chance for a cure. Indeed, where you live should not determine if you live. Promoting greater equity in access to cancer services is one of the most important ambitions of UICC. Millions of people worldwide face unequal access to cancer diagnosis, treatment, and care. We know that approximately 70% of all cancer deaths occur in low and middle income countries. Estimates released last year indicate that Asia and Africa face the highest proportion of deaths compared with these regions' cancer incidence. This means people dying prematurely. This means grief. This means social and economic loss. This means loved ones dying too early and with excruciating pain without having had the chance to launch not even a single strike at cancer. The injustice is personal and very real. This is true not only in low and middle income countries, but also in high and upper middle income countries within higher risk populations, including indigenous, immigrant, refugee, rural, and poorer populations. The tsunami of cancer cases anticipated in the coming decades, with annual incidents already exceeding 18 million, requires a persuasive and robust response at all levels. We need governments to step up their efforts in cancer control through concrete action and investment in essential medicines and technologies for cancer patients. This necessary response is even more possible with the support and collaboration of public and private partners. Multi-stakeholder collaboration has the potential to bring together a wide range of brainpower, commitment, and resources to tackle the complexity of the challenges far more efficiently and effectively, and with more creative and innovative influences than to go at it alone. At UICC, we are convinced that an engagement of multiple stakeholders can drive transformational change in access to quality cancer care and ultimately save lives. It is for this reason that UICC established the City Cancer Challenge initiative and incubated it to become a standalone foundation. The City Cancer Challenge is truly a new multi-sectoral, innovative paradigm on how we implement cancer control. The foundation identifies the appropriate management structure and channels for technical assistance, partnerships and collaborations locally and internationally. Then calls on a network of motivated partners, including city leaders, governments, civil society organizations, UN agencies, and domestic and international businesses to assess and respond either with expertise or financial support to the city's most pressing cancer treatment needs to ensure implementation of the city plan. Access Accelerated's role in this life-saving effort is crucial. It is also an innovative way of how the pharma industry organizes itself to support the City Cancer Challenge. I thank Japan IFPMA for being a big part in this. UICC also launched a new innovative advocacy model, its flagship initiative, Treatment for All. This initiative seeks to engage the entire cancer community in translating global cancer commitments into national action, with emphasis on low and middle-income countries facing the greatest growing cancer burden with the fewest resources. Through Treatment for All's National Activation Initiative, which now engages 20 UICC member organizations named country champions, civil society in these countries are supported in developing and bolstering meaningful relationships with government and private sector to further enable the delivery of a national cancer response to improve patient outcomes. These are only a couple of examples, but they show the magnitude of UICC's ambitions to contribute to a reduced global cancer burden, and how this is made possible through our incredible network of members, partners, and the extended cancer community. We each have an important role to play, either in promoting greater equity in access to basic cancer services in some of the lowest resource settings, or in supporting the development of innovative, targeted, and still affordable therapies with significant clinical benefit in countries where the health infrastructure or cancer care is more developed. We need innovation in all our tools to fight cancer. We need continued innovation in therapies, technologies, partnership models, implementation models, financial, dissemination, and distribution models. Innovation in all of this is key in the fight against cancer. However, it is only when innovation is coupled with equity and accessibility at the outset of its design can it have the potential to transform the lives of millions and millions of patients around the globe. Thank you again. I wish you fruitful discussions on what you can do during the rest of today's seminar. Thank you.
ディナ・ミルアド様からのビデオメッセージでした。